Hi, my name is Kent Johnson. I work for LA Sports Performance Care. This is my model, LA Man. And today we're going to demonstrate self-spinal long tract release. Okay, and the purpose of the self-spinal long tract nerve release is to actually stretch the dural or the connective tissue that surrounds the spinal cord, the brain, and the nerves in the body. And the nerve we're actually be paying attention to today is going to be the sciatic nerve. And the sciatic nerve is a pretty big nerve. It's about the size of your pinky. So we actually stretch that nerve, then we're going to, and we tug on it. We can actually tug on the bottom of the spine. Okay, you need to be careful. Okay, you only do this if it's been prescribed. If you have any sort of discomfort, sharp pains, or if you're acute low back symptoms, you know, you're in the middle of a acute flare-up as far as a nerve root or some sort of disc injury where there's a disc a herniation or a bulge or even a tear in the annular fibers, this is probably not warranted, and you should wait and get instructions from your doctor. This is pretty involved, so please pay attention and do it exactly how we're telling you to. Okay, so what Allie's going to do is she's going to use her left leg, so she's going to actually test the range of motion for left leg, her hamstring. So she's going to extend her left leg, dorsiflex her foot. That means she's going to pull her toes back, and she's going to lift her leg up as far as she can, and that's within reason. You're not going to crank on this, but you need to know where you're starting. Now she's going to go ahead and bend her knee. Okay. And what she's going to do is she's going to take the pillow and put it underneath her head, because we actually want to go ahead and actually create a little bit of tension on the spine, and she's going to do pelvic tilt. She's going to do 5 of these. And as you notice, the range of motion is complete. She's going all the way back. She's going all the way forward. That's an anterior tilt. Now she's going to go posterior. And she can actually pull her stomach in and actually even squeeze her glutes a little bit when she goes back. There you go. Good. And then she completes her 5th one. She's going to remove the pillow, give her spine some slack. She's going to rest her head down, and then she's going to extend her leg, pull her toes up towards her. That's what we call dorsiflexion. Locking her knee, she's going to go ahead and give us internal and external femur rotation or hip rotation 5 times. So we're mobbing the hip, but also what we're doing is we're actually stretching the sciatic nerve. We're actually getting that nerve to glide through the muscles. And then she's going to go ahead and actually extend her leg, pull her toes up. She's going to lift her leg up in the air, and she's going to do that 5 times up there. She's actually going to turn it in and out. And notice that her knee is actually extended. It is locked. Her foot is dorsiflexed. Now she's going to bend her knee. She's going to put the pillow back underneath her head again. And she's going to give us 5 pelvic tilts again. And by doing the pelvic tilts, we're actually, again, stretching that connective tissue. We're getting her spine to move all the way up and down the spinal cord there. And what we like for you to do as well is, if you can, just a little bit, keep your chin tucked down just a little bit. Okay, but not too much. Now you have to use a pillow. You cannot just hold your head up. For those of you that are experiencing thoracic or cervical discomfort or some sort of dysfunction, you have to do this. Now she's going to extend her leg, pull the toes up. Now she's going to turn her femur in, and now she's going to flex her hip. And now what she's going to do, she's going to give us 5 circles with her internal rotation. Now don't be wild about this. Be controlled. Take your time. Okay, and then she's going to go the opposite direction. And then when she finishes that, she's going to actually externally rotate her femur, and then she's going to do it again. Now if you have any sort of pain in your hip or your back while you're doing this, you need to cease right away. You need to stop. Good. Now she's going to go ahead and bend her knee again. We're getting there. We're almost there, guys. Now she's going to go ahead and reach out and grab the pillow, put it underneath her head again. And she's going to give us 5 more pelvic tilts. And now, again, just want to go ahead and emphasize, we're not moving into pain. Okay, if the extreme ranges of motion while you're doing this is causing discomfort, and if you shorten it, it actually feels more comfortable to you, then that's what we're going to work with. Okay. Then once she completes her 5 reps, she's going to extend her leg again, pull her toes up towards her, okay, dorsiflexion. She's going to internally rotate her femur. She's going to flex her hip again. Here's the important part. Now she's going to point and flex her foot. That's plantar flexion and dorsiflexion. And she's going to go ahead and pull her leg up towards her head just a little bit more because we want a nice stretch in that sciatic nerve. Now this is where we're actually starting to affect the sciatic nerve way at the top there, where it actually inserts into the foot. It goes down the leg. And then when she gets finished doing that, she's going to actually give us 5 ankle circles in each direction. Okay, so you want this controlled. The leg shouldn't be moving all over the place. And you definitely want to concentrate on pulling the toes down. That's what stretches the sciatic nerve as it goes down the leg. And then when she actually does that, she's going to lower her leg, pull her toes back towards her. With your femur in a neutral position, you're going to actually test to see what changes you made, and you should feel like the leg's actually moving further. Okay, good. So you're going to do that on both sides, okay? And doing it once or twice a day is sufficient. This isn't something that you should bang away at like it's resistance training or you're doing yoga or something like this. Remember, we're actually stretching the connective tissue around the spinal cord and the brain and the nerves, and that tissue is easily irritated. Again, if there's any sort of discomfort that's higher than a 2 or a 3 on a scale of 0 to 10, then you need to go ahead and stop. Okay? All right.